what's better to start an international cooperation with other than health and saving lives? Which brings us to first-of-their-kind agreements between Sheba Medical Center of Israel and the two largest hospitals in Bahrain. And we'd like to hear more about it from our guests, Dr. Nabeel Al-Asheeri, Chief of Medical Staff of Center of Excellence in Bahrain, and Yoel Har-Even, Director of International Division at Sheba Medical Center of Israel. Thank you, gentlemen, for joining us today.
Hello, good morning.
Hello, good morning. Thank you. It's a great pleasure to be with you today.
Dr. Al-Asheeri, I'd like to start with you. Why Sheba? What made you choose them?
Yes, Sheba Medical Center is an advanced medical center. Actually, it's an advanced medical center in the region, and it has been recognized as well as one of the 10 best medical centers in the world. So I think it's going to be a great opportunity for Bahrain to have a cooperation with such an advanced center, with such advanced facilities and advanced medical practice.
Yoel, what can Sheba offer the hospitals in Bahrain?
First, I want to say Sabah al-Khair to my close friend, Dr. Nabeel Al-Asheeri from Salmania Hospital and Bahrain authorities. I think, Jacob, both Israelis and Bahrainians are sharing the same values, and especially when you are talking about medicine. So I think the cooperation between Bahraini and Israelis will be going very, very smoothly because of those reasons that I just mentioned.
Dr. Al-Asheeri, what are your needs mostly in terms of technology, innovation, current medical technologies?
Yeah, first of all, Sabah al-Khair, Dr. Yoel. My friend Dr. Yoel, I say Sabah al-Khair or good morning to you again. As I have mentioned earlier, Sheba Medical Center is a very advanced medical center in the region and in the world. In addition to that, as you know that geographically, Sheba Medical Center being in Israel is not also far away from Bahrain. It might be just 3 hours away from Bahrain. Sheba Medical Center has a lot of advances in the fields of medicine, especially cancer treatment, neurology, neurosurgery, orthopedics, obstetrics, and gynecology. In addition to this, they have also a lot of expertise in the field of medical research. So Bahrain could benefit a lot from all of these areas. In addition to this, Sheba Medical Center could be a hub for the training of Bahraini physicians or even medical personnel. So these people could go to Sheba, have their training there, and come back to Bahrain and share their expertise as well. In addition to this, Sheba Medical Center has a lot of very professional and very experienced medical professors or professors in surgery and medicine and all the medical specialties. Bahrain could benefit from Sheba Medical Center in this aspect by having some sort of a visiting professor program to Bahrain. And at the end also, Sheba Medical Center provides a lot of for very advanced medical care, especially in the oncology or the cancer treatments. So Bahraini patients could benefit from this by sending even Bahraini patients to get treated in Sheba. So all of these are areas in which Bahrain can benefit from the expertise of Sheba Medical Center.
Yoel, how do you do this on the ground? You have staff going to Bahrain and vice versa. How do you operate this?
It's only 2.5 hours flying, and Gulf first started direct flight. So technically, it's very, very easy. We already started face-to-face meetings with our colleagues as Nabeel Al-Asheeri. And soon we are going to have our staff going there for training and education and accept Bahraini physicians and healthcare providers also here at Sheba in Israel to go under training and education for our programs. So training and education, both sides will be, I think, the first steps that we will take with our colleagues. And when the year and we get some progress, I think we will start research program together and exchanging physician for long-term internship, both going to Bahrain, but also coming here to Israel, to Sheba, to share the knowledge that we gained in the past.
Mm-hmm. Dr. Al-Asheeri, well, describe the interaction, if you will, between Bahrainians and Israelis.
We already had direct interactions. We had the delegation of Dr. Yoel and maybe the other staff members coming from Sheba. We had also another delegations, like we had Karen and we had Dr. David as well. We set up plans. We had discussions and we set up plans. We put our priorities and we put our needs, and they were very understanding and they were very supportive and they were very open to all sorts of cooperation. And we have at least initially put a starter plan of the way things should work. So we're trying to execute our plans, as Dr. Yoel have maybe mentioned earlier, that we are already have agreed to do some sort of training for Bahraini physicians in Sheba. The same thing about research. We might have a joint research projects together. And the same thing with sending Bahraini patients for the treatment. Maybe there are initial plans, but eventually we are going to execute all of these. The same thing with the treatment, with the visitor professor program. This will be executed and eventually, yeah.
Yoel, do you see this cooperation evolving later to future research or other areas or even more ambitious projects?
Absolutely, Jacob. I think this is just the beginning. We are doing our first steps with our colleagues. And as I told you before, there is a large field of cooperation. We will, in the near future, we will bring Sheba Innovation Medical Center, ARC Innovation, and talking about digital health to Bahrain, because Bahrain is inspiring to be a hub for the region. So I think also in the subject of medical innovation and digital health, which Sheba is very strong with, we can collaborate and work very, very soon.
Dr. Al-Asheeri, you think there's more to come later? Absolutely. I think this is just the beginning. And I think definitely we're going to progress more. I think there are going to be a huge cooperation, at least in the medical field, between our center in Bahrain and Sheba, certainly.
Tell me, Dr. Al-Asheeri, how did you cope in Bahrain with the COVID pandemic?
Yes, COVID pandemic was considered as a national crisis, as other areas in the world. Luckily enough, I would say that Bahrain was the COVID crisis, or the way the COVID crisis was handled in Bahrain, was definitely a success story for Bahrain. Bahrain has been recognized to be one of the best places that were able to deal with the COVID in a very successful way. And this is not only on a regional level, but by international levels. As you know, that even the World Health Organization has praised very much the way that Bahrain dealt with the COVID crisis. This would not have happened, and except if it was not considered a national crisis, and except if the government wouldn't have put all its effort and all the support to the medical facilities to take care of the national crisis. Bahrain was very innovative in establishing treatment centers. For example, turning the car parks into intensive care units for treatment of COVID patients over a 1 week time. This was very innovative, and this was very distinguished achievement for Bahrain. Number 4, which is the providing of vaccines. Bahrain government provided almost all of the recognized and approved vaccines in the world as soon as they were approved and as soon as they were available. There was a huge campaign for the vaccination of patients, that almost all of those that were eligible were vaccinated. And the same thing, we are even started the vaccination for children. Putting all of these together, we had one of the most successful experiences in treating the COVID. We had very low mortality rate. We had very high recovery rate. Even the number of patients that are in the ICU are extremely low. In Bahrain currently, we are feeling that success on the ground. Bahrain, we have lifted almost all of the restrictions, maybe with just little precautions, and we are even heading towards normalization of life to the pre-COVID area, hopefully very soon.
As of today in Israel, tourists are finally welcome. Yoel, Sheba was in the forefront of fighting COVID in Israel. That was quite an experience, right?
Absolutely, yeah. Quite an experience and a roller coaster in the last almost 2 years. But happily, I think now we are, on the top and in research and treating, and we didn't touch base about research in COVID and new technologies, but I can elaborate that Sheba and Bahrain are also sharing some experiments about saliva test that's coming from the Sheba House of Digital Innovation, and one of the locations are going to be Bahrain for sure. So the future is for us.
Let me ask you finally about the human touch. Dr. Al-Asheeri, your staff, your doctors, they are welcoming this cooperation. They would like to meet Israelis. How does it go?
Yes, the staff are having a good feeling about all of this. They are welcoming the cooperation. They feel that this cooperation is going to open new doors, new venues for cooperation, new venues for training, new venues to get exposed to different experiences, especially meeting other professors and other medical health workers that have a different view and maybe different scope of thinking and practice in the medical fields, which eventually will improve their experience and will improve the way they are practicing. So hopefully everybody is optimistic and everybody is looking forward to be part of this cooperation.
Yoel, you have your doctors waiting in line to fly to Bahrain?
Absolutely, and as I mentioned, it's my third time traveling to Bahrain in the last 2 months. I found there a very warm and open people. They accept us as brothers, as cousins. There is no secret when you are dealing with medicine and healthcare. So I think being separated in the last 73 years, it's not a reason anymore. It's not a cause anymore. And we are looking forward to accept and get our colleagues here coming to Sheba very, very soon, and continue our visiting with my staff, with my physicians and nurses and health workers, as planned with Dr. Al-Asheeri in the future.
Well, gentlemen, thank you very much to both of you, and the best of luck. Thank you.
Thank you. Ma salama ya habibi.
Thank you.
Stay safe.
Thank you. Feel safe.
Thank you, Jacob.
Take care. Thank you, Jacob, and thank you, Professor Yoel.
And this is it for Middle East Now. We'll see you here tomorrow. Have a good night.